we're good to go with your update.
Okay, very good. Good afternoon. I'd just like to give you an update. I want to start off first by giving you some more details on the second case that we had in our region. When we sent out our press release yesterday, we did not have all the details. The ministry has a process of letting us know and a sort of a sequence of how the press releases are released. So I have more details now following our investigation. And so I can share with you that this individual came from the UK on March 11th and is a resident in the Prescott-Russell area. And he was picked up at the airport by his son, driven home directly where he lives with his wife. Those are the only two contacts. There have been no contacts since. He has been, this individual developed symptoms upon arrival at home, a bit of a headache, and then started having more symptoms with a bit of fever and chills, and decided on the 14th to get tested. He went to one of the Ottawa testing sites. Between the time of his arrival and the time he went to the testing site, he had not gone out. He had not had any contact other than his wife at home. And at the point he got tested. Obviously, when he was tested, he had a mask and all the usual personal protection maneuvers were done, and so on. Basically, we got the results several days later, and he remains at home. He is stable. He was not hospitalized. I want to repeat that. And he's on self-isolation, as is his spouse. And the individual that drove him home is also on self-isolation, and reportedly to this time doing well. And so that was the first, some of the details that we got of that case. We're going to be looking at mechanisms now where we can more robustly send out the information, including putting them on our website. We'll now speaking with the ministry now, because we're getting so many cases at the same time. It's hard for them to catch up in their central registry. A lot of them are put up as pending, and so we're going to be working with them to facilitate a mechanism where we can ourselves put up the information at the local level, which we get. And sometimes, like I said, we will be posting that there is a positive case, but sometimes we, in the middle of investigating contact tracing, sometimes it depends on how many people we have to trace and so on. But we do believe that it's important for us to have this information. However, I think at some point, when we start getting more, hopefully we're not going to get to the point, but I really think we will. When we start getting more cases and we start seeing and accepting that it is a community-based spreading, which at this point we're not, obviously it's going to be a different mechanism where testing and number of cases will not be relevant. Our situation at that point will be to ensure that our hospitals and emergency rooms are not overwhelmed, and at the same time to ensure that whatever spread is out there we can minimize by continuing and or enhancing the current public health measures, which include social distancing and so on. So that's really what I wanted to update you on that. I know that we're getting a lot of questions about assessment centers, and again, we're working diligently to set those up across the region. We will be in a position to be able to announce when they're open very soon. It's just that we're trying to coordinate a multitude of sites almost at the same time, although they will be launched based on the individual need locally. Initially, like I said, they will be testing sites, but I think, and I'll be honest with you, at some point when we don't rely on testing anymore, because we're doing testing really to try to contain and try to get a bit of a surveillance of what's going on. But once these testing is not going to be recommended on a regular routine basis for for individuals who we suspected, and they'll be labeled as probable cases. These assessment centers are designed really to be alternatives to the emergency room because if a large number of people get ill at the same time, albeit most will have minor symptoms, they will be worried, and we don't want them to go to the emergency room. We want to offer them these alternatives. And so we're working very closely with our 4 hospitals. We're monitoring surge capacity, ER visits, ability to maintain those throughout the hospital and throughout the emergency room staffing and so on. And those will be kind of the triggers that we're using it. So when we talk about assessment center, although our initial kind of approach was really to have it for people to get tested. At some point, that's going to switch, and it's going to be the same place, same location. We're actually equipping these to be assessment centers because the difference between a testing center and an assessment center would be that for testing, you just provided you qualify. Right now we're testing people who have symptoms and have a 14-day history of travel outside of Canada or have been in contact with a person who has had COVID-19. And so for people who require testing, we would offer those as well. But like I said, at some point, the main, I think, crux of it would be that these would be manned for the purposes of medical evaluation, either by a primary care practitioner, a nurse practitioner, or some of our community-based paramedics. And again, to me, that would be quite important for us to have. And again, will we launch all of them? Will we launch 2 of them? Will we launch 3 of them? Depends on the need and the rate of infection that we see, and the rate of overwhelming numbers to the emergency rooms. So that's really where we are. Our next kind of approach is kind of looking at what the numbers would be, what the trigger would be to be able to move to sort of the next step. I know that I had a question here, so I'll sort of go through the questions first, and I'm trying to follow them all. One of them is, what is your sense of how well Canada and Ontario are doing to flatten the curve? Well, at this point, it's kind of hard to say because we haven't even got to the uptick of the curve, which I like. I like to keep the curve flat. I don't want it to see sharp increases. So far, I think we're doing well. The other thing, too, is we're not going to see any impacts on that curve for a couple of weeks at least, if not longer. However, we might see, and I don't want people to get discouraged, we might see a bit of an uptick. Like today, Dr. David Williams talked about, I think there were 54 more cases overnight from yesterday as compared to 9 the previous day. It's not surprising that we get more cases because we're getting a lot of imported, and most of them are imported or related to somebody who had contacted an individual who had brought it in. And so in that situation, we really want to make sure that we were able to essentially prolong and flatten that curve together. And so that's what I mean by the flattening. That's how we can measure it. So, and the question is, the other thing too is what I was going to say. I kind of lost my train of thought there. Was really that influx of a lot of the Canadians coming from the United States, and a lot of them from hotbeds like Florida and New York, will likely bring up our numbers, and it'll be very important that those individuals are self-isolated and identified as soon as they have symptoms so we can further isolate them. So I do believe that we're going to get an uptick over the next couple of weeks, with infections because they'll be more imported, but our goal would be to minimize that infection going to the community, and if it does go in the community, I think it's a matter of time to, again, minimize the spread within the community. I also had some other questions here. Was interprovincial travel. At this point, we're not talking about interprovincial travel in terms of travel advisories. The only advice that we have is that we should not be going outside of Canada to travel. At this point, the same recommendations and same kind of level of social distancing is practiced throughout Canada. That may change depending on regional activity, but at this point there isn't any measure at this point, but there could be depending on the activity. And I think I had one other one here. Yes, another one. Somebody said the reports of quinine, which is a malaria drug, apparently having some utility in treating the sickness. I'm not sure. I'm going to actually look into that and report back to you tomorrow. It's interesting. It's also interesting that they've tried some antiretroviral, in other words, some HIV drugs, and I heard that they didn't have very good response. Study just came out a couple of days ago. So that's what we're looking at as well. One of the other things that I'm going to be looking at is the speaking of medications, is the recommendation by the World Health Organization recognizing that perhaps ibuprofen taken with by individuals who have COVID may make the symptoms worse. So I'm going to be looking at that, and because at that point people would say, instead of taking ibuprofen, you take acetaminophen. That's another thing that I'll be looking at. I know that the World Health Organization is investigating it, and it's something that we need to keep in the back of our minds. So at this point, I'm going to leave it to questions for the next 5 minutes or so.
Just a clarification, Bill Kingston, Cornwall News Watch. Just a clarification or some other points on that second case.
Yep.
What airport did the person fly into?
Ottawa. Ottawa Airport from the UK.
Yep.
And we're at this point, we do not believe he was contagious on that flight because he did not. His symptoms started afterwards. But we've notified Public Health Ontario so they can put that on an advisory. But at this point, we're not convinced that this individual was infectious. Had he been symptomatic, there would have been a bit of a callback and looking at around the 3-seat parameter around him.
Yeah, in your release also said he was discharged. Like the last Prescott Russell case, was he tested at the Alexandria Hospital? No.
Sorry, he was tested at the. He went himself. He was driven by his son to an Ottawa the Ottawa testing center.
Okay, perfect.
He was not hospitalized ever.
Dr. Paul, Phil Blanchard, yes. Morrisburg Leader. The release that came out said that late Tuesday, March 17th, that the test was confirmed, but we didn't get notification by press release until the 18th after the press briefing. Why is there such a day and a bit of a lag?
That is because the ministry wanted to put their release first, and then they wanted to release it on their website first, and then us release it, frankly. Which is something that we're negotiating with them now, saying, we need to get the information out. But frankly, at that point, we didn't have all the contact tracing finished. But that's really the reason. And I've been on the phone with the ministry saying, look, at this point, you're getting so many. It's hard for us to wait for your cycles to be able to coordinate things that way.
Okay.
I'm blunt. I'm being honest with you.
Oh, sorry. James Morgan from the Review in Van Cleek Hill. I was wondering if have you been in touch with hospitals? Is there any concern about the amount of ICU beds available?
Look, that is actually, if you ask me generically, yes, we're worried about ICU beds availability across the province. I think at this point, what we've done in the region is we're collecting. We have a surplus of ventilators. It's not more the ICU beds; it's the ventilators. And so I know that we've got the ministry has hundreds of them now in surplus. And as a matter of fact, we have a sort of an inventory throughout the hospitals in the east region of the territory here of Eastern Ontario. So we know that we have ventilators. We have almost like a GPS of where the ventilators are, and they can be passed around. So even if we don't have room, for example, Dr. Dave Williams just answered that on his teleconference before. Okay. Even if we don't have enough rooms, we can put 2 in a room, and as long as we have 2 ventilators, let's say. Right. And that's the rate limiting factor in Italy was shortage of ventilators, not rooms.
Dr. Paul, Nelson Zandbergen at Nation Valley News. I was wondering about the ventilators and who has paid for them. Our hospital foundation out here always tells people that the government doesn't fund hospital equipment. Is an exception being made for ventilators?
Yes. The ministry has bought literally hundreds of them.
Okay.
Yeah.
Dr. Paul, Nick Seabrook, Cornwall Seaway News. You previously said that the test usually takes 4 to 6 hours for results to come in. How come results for this second case, the results took days? Because
the lab in Ottawa is overwhelmed. They have a lot of demand for testing, and that's why. So I know I've spoken to the lab. They're now increasing their capacity to be able to do many more in a day. And so that's where the delay is. We're constantly on the phone with them, asking them, what are the results? What are the results? And in many cases, we haven't done the test ourselves. We just get called by the lab saying, by the way, it's because they have to call us as soon as it's positive.
Mm-hmm. Dr. Paul.
Yes.
Go ahead.
Go ahead, Phil, and I'll go after.
Okay, sounds good. How many ventilators do we have?
I don't have that number here locally or in Ontario.
Like within the EOHU, the 4 hospitals that serve the EOHU area, you said you have a GPS of where they all are. So I'm just asking, how many are there?
I don't have the exact number for our area. I'm saying the GPS is for all the region. I'll get back to you on that one.
Okay.
That's a good question.
My question is, we've had workers approach us, and this is about large plant settings. And the ones in question are Walmart Logistics and Olymel. Workers have come to us; they're afraid they won't speak out because they're in fear of reprisal. But they've been told that they knowingly know that there are people working on the line that have returned from vacations in the United States under the directive of the public health agency. They're supposed to self-isolate, and they're not. So I guess, have you heard anything about this, or have you been in contact with these large companies, large factories where there are hundreds of people working in close proximity?
Yeah, that the Premier, I think, alluded to that this morning in his press conference. I think one of the things that we're looking at, Bill, is sort of a context of, okay, in a workplace, what can you do to mitigate it? What are essential services? What are not? Right? Like we talk about hospitals being essential workers. We talk about you could imagine that if a big percentage of the staff are home self-isolating. What are you going to do? Are there measures perhaps you can sort of to put in place to allow workers who are essential to sort of be an exception of the self-isolation rule, where perhaps they wear masks or they distance themselves or they self-monitor, don't go into work. So it's not a straightforward answer. Obviously, if I consider food and those things are essential services, and as you heard this morning, the legislature just now enacted cancellation of noise violation codes, allowing delivery to occur 24/7. So they could allow for those to go. So you can see where I'm going with this. I can't comment specifically on these big factories, but like I said, where factories are providing essential services or services that we need, food chain and so on, we're looking at mechanisms of saying, okay, perhaps what you can do is you can, if you absolutely need that individual who should be self-isolated, we'll know about it, but you could, work out a place, perhaps you could wear a mask. Perhaps, again, a mask to ensure that he doesn't infect others. He won't come in when he's sick. Distance him. Have him work with other people. Disinfect the area. Those type of things. We have to be logical about it. Obviously, if it's a non-essential worker, I would insist that individual goes home because they need to go home. But if it's an essential worker for, like I said, and not necessarily healthcare, it could be water treatment plant. It could be air traffic controller. It could be all these things that are essential. You can't not have people there. So I can't really speak on that one, but I'm just giving you kind of a gist of that. And again, it's going to be we're going to be getting some more guidelines to workplaces in that regard very shortly. I know that the province is looking at that.
You are going to give guidelines because I get the gist from workers that management really doesn't know what they should be doing, and some of them telling us that we were not allowed to wear masks or that sort of thing. So well, let me be clear. First of all, masks, like I said, to protect others is not there. But in certain situations, if, for example, you suspect, that I have, or somebody suspects an individual has something or is potentially infectious, if that individual wears a mask, he's protecting the others. It's in that sense. But then again, there's a shortage of masks, and there's all kinds of factors that come into it. But the bottom line, Bill, is that we need to look at those mechanisms that allow but keeping everybody safe, right?
but allow some essential workers to sort of break that 14-day self-isolation. Now, I'm not saying that this will apply to everybody. I'm saying that it applies in a very small subpopulation that is actually essential to do the work for either healthcare, service providers, infrastructure, and those type of things.
Okay. Stéphane Bourgeois from the Regional here. I was wondering if there was any penalties or fines given to people that would broke the recommendation going out of their self-isolation.
Yeah. At this point, the self-isolation is not an order. I am able, as a medical officer of health, je peux le faire en français si vous voulez. Comme médecin hygiéniste, j'ai la capacité, j'ai le pouvoir d'ordonner une quarantaine obligatoire avec toutes les amendes. Mais ce sera impratique de faire ça pour tout le monde. Mais si on a des cas, par exemple, disons que quelqu'un est en isolement et il a la maladie comme telle, moi je trouve ça comme un risque. À ce moment-là, je n'hésiterai pas de donner une ordonnance de quarantaine avec les pénalités pas mal importantes. And the other thing that I want to say as well, because this has to do with enforcement. I know, Bill, you asked this, and others have asked this of me. You know, the provincial order has been now to, and I hope you can share this with others. The provincial order was a sort of a blanket order closing all kinds of establishments. And I know that there have been, not only in our jurisdiction, but across Ontario, many calls and many people saying that, you know, such and such bar is open, such and such, you know, establishment is open despite it. Now that we looked into that, and the chiefs of police across Ontario received the directives, which essentially say that those are, because it's a provincial emergency order, those are enforceable by the police, and with all kinds of penalties associated to it, criminal penalties and so on. So we're directing people, if they do see or fear that one of these establishments is open, not to call the health unit, because we don't have authority in that regard, but to call the police, either the Cornwall Police or OPP, depending on where they are. And I've actually spoken to the chief in Cornwall and some of the other and the OPP officers within the other posts, and they're very well aware and are prepared to take action if necessary. I think this is an important point. I think people should know that we're taking this seriously.
And what's your plan? From the schools are now closed, but the break or the holiday break is coming to an end. Do you have a plan for the upcoming weeks?
Yeah, well, the schools are closed for another 2 weeks after this. They've already been ordered closed. So we have this week a spring break.
Yes.
They're not going back until April 5th.
April 5th.
Yeah.
Dr. Paul,
okay. I'll take one last call. One last question, please.
Je pense que c'est pour moi. Juste une question en français. Est-ce que vous avez la localisation exacte des futurs centres de dépistage?
Nous allons avoir 5 dans la région, mais ils sont pas ouverts encore. Ils vont être à Hawkesbury, à Castlemaine, à Alexandria, à Winchester et à Cornwall.
OK.
OK? Mais on va avoir bientôt des nouvelles sur ça. On est en train de voir quand on pourrait les ouvrir, si elle a un besoin ou pas. Parce que on doit être prêt en cas qu'on a besoin.
S'il y a le besoin, ça veut dire si on passe à une autre phase?
Deux choses. Si on passe à une phase qu'on a des maladies, qu'on a les infections locales et qu'on a une surcharge importante aux salles d'urgence.
Est-ce qu'on sait d'où vient le deuxième cas? Est-ce que c'est à Hawkesbury, à Alfred?
Non, c'est de Prescott Russell. C'est de Prescott Russell.
On ne sait pas dans quelle municipalité.
Non, on ne le dit pas.
OK.
OK, merci. Thank you very much, everybody.
Thank you.
Thank you.
Bye-bye.
Bye for now.